Hi, everybody. I'm Tracy Gaudette, and welcome back to The Whole Health Story. I'm the Executive Director of the Doctorate of the Whole Health Leadership at SCU. And today I'm going to do a little orientation to a really great tool called the Whole Health Reflection Tool. If you want to follow along with me, you can click the link below or in our bio and download the reflection tool. I'm going to just orient you to this, and in the next segment, if you want to join me, I'm going to actually walk you through the process of doing the health reflection tool. But let me start by just orienting you to the tool itself. So the front page has the graphic of whole health, as we talked about before, starting with meaning and purpose, pause, notice, choose, self-care, professional care, and community. The other thing I like about the front page is it also talks, so if you're doing it on your own for the first time or sharing it with other people to do, it gives you some of the basic principles about whole health, which are really important to orient people to this approach. I won't read those, you can read those yourself, but that's on the front page. The next page is an opportunity for people to reflect on their current state of well-being. And so these are scales that go from miserable, 1, to great, 5. And we ask people to reflect on their physical well-being, their mental, emotional well-being, their spiritual well-being, and simply how is it to live your life day to day, miserable to great. Also on that page is the space where we're asking people to reflect on what brings them a sense of meaning and purpose to them, what matters most to them. And this is a deep question. So the first time through, it's just your initial reaction and reflections on that. We love for people to do this tool repeatedly. It changes really interestingly over time. The third page is now walking through each of those areas of self-care and asking people, first of all, there's a good description of each of those areas because it may not be what people think. Like moving your body is not about have you exercised today? It's much more about your relationship with your body and how you could improve that relationship. So there's a description in each of those areas of self-care. And then the question is asking yourself or your people to reflect on a scale of 1 to 5, where 1 is really awesome and where 5 is really awesome and 1 not so great. Where are you now in that area of self-care? And where would you like to be? And that is a really interesting reflection because you may be pretty low on the scale and you're just fine with that. It's not an area of self-care where you want to really excel in. Not everybody should be a 5 in everything or you wouldn't want to hang out with them. So the rest of that next page is now allowing people to reflect on where would you like to start? If you were going to take one step towards your health and well-being, what draws you to start and what action might you take? So that's a quick orientation to the tool itself. We have found it to be very helpful, and in the next session with me, if you want to join, will be a little bit longer because I'm going to actually guide people through using this tool. So I hope, and you don't need to be guided, just dive in and do it yourself. That works great, but I hope you find it really useful and a first step in your whole health journey.